Hi, everyone. Thanks for joining us today. Let's get going. We're going to spend the next hour or so with our partners from United Way of Metropolitan Nashville. Matt Preston from United Way and Hannah Wolchin from Elevate Evaluation will discuss the history of the Family Empowerment Program, and they'll also describe their program model, their funding, their efforts to collect and use data that they collect, and lots of other good stuff. So we're really excited to have them share about their program and share some of the good things they've done and how they've grown the program over time. Just a few little housekeeping notes before we get going. Please mute your phones and your microphones while you're on the call. We don't want to get any background noise of dogs barking or anything like that. There will be time for questions at the end of the session. Please use the chat window to ask questions and make sure that you chat to everyone rather than just a specific person. That way we can make sure that we all see it. We will make the slides available after the presentation. I'll send out an email to everyone and give you a link to that. And finally, we will be recording this webinar and posting it on YouTube, on our YouTube channel in the very near future. So if you have any colleagues who can't make it today, they can find that YouTube video. And again, I'll share the link to that, and they can check it out. So without any other delay, Matt and Hannah, please take it away.
Hello, everybody. Thanks so much, Ryan, and thanks to the Seymour Institute for giving us this opportunity just to share some things that we're seeing in Nashville, some things that are happening that we're really excited about. So my name is Matt Preston. I've been working at United Way for about 1.5 years as the senior manager of the Family Empowerment Program. So before that, I was at Catholic Charities, and Catholic Charities is one of our Seymour-funded partners. So I was able to supervise some of the case management work whenever this program started back in 2014, and now I've kind of come over to the funding side. I'm also just excited to have Hannah with us today. She's with Elevate, like Ryan said, Elevate Evaluation, and they're here in Nashville as a consulting firm and are really dedicated to helping nonprofits evaluate their programs and really use the data to kind of inform processes. And we've been collecting a lot of data. I mean, we've been collecting data since 2014, and I feel like we're, maybe finally at the point where we can start really asking the right questions and using it, like really using the data to help drive some things that we're doing. I think we've always said we wanted to do that, but it takes time to get there. And our program looks really different than it did when we started. I mean, most of the changes have been so positive and rewarding, but it's been really hard. We've had a lot of things that have come up as challenges that we've had to work through together. I know the other day somebody asked me, what do you do for your job? And I think I responded, I just plan meetings. So my role has changed. I feel like we're trying to make sure we're using time well in meetings to drive these things forward. And I just want to acknowledge before we get started that really the work that's being done on the ground, we're so grateful to have the partners that we do, and we'll talk through kind of our partner structure, but they're the ones that are sitting with families, that are hearing stories every day, that are, hearing tough stories, but hearing aspiring stories. So I just want to make sure I acknowledge that we're really thankful to work with those partners. So we're just going to look at the agenda here. I can kind of share what we're going to try to cover. So we're going to do an overview of the FEP, and we're really coming at this from like a 30,000-foot view. So we want to give you kind of how our partners are structured, how we've seen the funding change and see our funding grow over the last 4 years. We'll talk a little bit about collaboration. We've contracted with Elevate, so now we have we have an evaluation approach that we can take, and Hannah's going to really dive into that and about our learnings, about our outcomes that we're seeing. And then if we have time, we're going to talk a little bit about some ideas we have on the horizon. So we're definitely excited to share with you guys today. So this first slide is really, this is a handout that we use to kind of show just a snapshot of our continuum of care, really. In 2014, when we started the program, we were really trying to address a gap in services. Our Metro Public School System knows that, and the numbers hovered around 3,000 students every year that families are marking a box when they enroll in school that says the family is homeless. And so we know that number is there. And before this program, there were really very few agencies that were out there in Nashville to help families navigate the housing search or navigate resources. We had, some agencies that could give kind of financial assistance or do some more transactional type things, but this is really the first kind of scope of work really focused on families that could kind of dive in and really provide that wraparound service. But since the beginning, the landscape of the work has changed, our city has changed, the housing market has changed, so we've seen a lot of these things happen, and we've kind of tried to make sure that we're responding to the reality that families are facing. We're also really involved with our continuum of care here in Nashville, so for some of you that are part of the continuum of care in your cities, we're really trying to make sure we're not siloing our work with families, that we're really seeing what other populations and other agencies are doing to make sure that we have kind of this unified system. But if you look at this continuum, these are kind of some of our entry points, and these are some of the areas of work that we focus on. And so these are some of the main components. And what we really want to see, and we know this isn't linear in practice. We know that we want to share and serve folks that are experiencing homelessness, but we also serve families that are housed and maybe are unstable, and we kind of provide some different interventions for that. And what we've been able to add in the last year or two is this kind of third section where we're trying to move families through this continuum into this thriving area. And this thriving area looks, it's actually really complicated on the ground because we're adding so many different things. But this is where we hope families can start building some goals around their career and increasing their wages, because we know in Nashville, if families don't have increasing income, they're likely to return to homelessness or even become homeless if they never have been, because our housing market is so difficult. And so I want to walk through each of these three areas though. So if we look at kind of this first section, we know with our coordinated entry system here in Davidson County that we've really helped kind of over the last few years. We were involved in kind of setting that up. We know now that we have about 273 families in 2018 that were literally homeless. And again, we have the number from our Metro Public School, the 3,000 students that are homeless. And so when we have a family that comes into the program that's experiencing this, we use a rapid rehousing approach. And so what those components are is we look at their, intervening in their crisis, so providing those basic needs to make sure that they can start making some decisions. We immediately look at housing, so making sure that we can identify housing as quickly as possible is one of the big key factors. And our partners have landlord connections where sometimes there are units available that we can, quickly move families in. We provide rent and move-in assistance for those families, and that is unique to each family's needs. It's not we don't have a blanket amount that we use, so we kind of make it unique to whatever the family is needing for that part of it. We also provide the wraparound case management for those families. And so we not only look at making sure that we're providing housing and helping folks move in, but for those who are already moved into housing but are experiencing some instability, we definitely want to look at preserving those units. I mean, in Nashville, I'm sure a lot of the communities that are listening, we're losing affordable housing every day. We have stats on Section 8 voucher folks that are not taking Section 8 vouchers anymore. Some of these numbers are really staggering, and it's making it really hard for families to find affordable housing. And so we want to make sure we're preserving units when we can and preventing evictions. So that's one of the big interventions that we call prevention, is keeping folks housed. We're also trying to do some diversion, and so I think a lot of you have probably heard of this term. We're really trying to start looking at what does it look like to do diversion in our community, and really make sure that families aren't entering shelter if possible. So partners are kind of trying to to understand what does that look like. Is it changing the assessment before somebody comes into shelter and making sure we've gone through all the options, before they stay, because we know if a family spends even one night in shelter, the chance of staying in that homeless system goes up tremendously. So we're trying to intervene in that way. We've also had families that come in that, maybe are not able to find housing quickly. They may be doubled up or with family members, and we've learned that may be okay for a short-term period. It doesn't mean that every family has to have their own housing as quickly as possible. If they're in a safe situation, a safe living situation, maybe we can help keep them there so they're avoiding coming into shelter and start building up some of the supports around them in that living situation. So that's what those interventions look like in the house section. And then I'll quickly kind of go through more specifically this thriving section. This is where some of our increased funding over the last year has really helped us kind of look at, and I say this a lot, but I think when we started, we really wanted to try to answer the question, how do we end homelessness, right? But we're also now realizing that we have to also start answering the question of how do we end poverty? How are we setting up families to be more sustainable in their housing? And so some of the things that folks can do now in the FEP is access training and set career goals where they're increasing their income, access someone who has expertise around that employment section or expertise around the financial portion, not only just case management. We're also partnering with child care centers and after-school care to make sure that we're addressing those key barriers of child care and transportation, and really making sure that we're keeping those services accessible as much as we can. And then if a family really does want to, go back to school, and we want to make sure providing that financial assistance to make sure they can fill that gap that they had before. So I really want to just kind of give you a picture of just what this looks like on the ground. This slide kind of shows our system of care that we've really built over time. Early on, we provided mainly case management, and that was through Catholic Charities and Safe Haven Family Shelter. And they were doing the bulk of the rapid rehousing and the prevention work, and they would refer out for other services that they couldn't really fulfill. But we realized that we have to address some of those key barriers of child care and transportation in order to move the needle on homelessness. So with some of this increased funding, we've been able to add new partners. So we partnered with Fanny Battle Child Care Center that provides high quality and affordable child care. And they were already committed to kind of offering opportunities for adult growth and learning. They have events every month that we've been able to come in and kind of support so that families can kind of work on the social capital piece. We actually just added McNeely, another child care center in East Nashville, and many of those families are considered under the federal poverty line. We've added Youth Life Learning Center, who provides after-school care and summer programming in really one of the most impoverished areas of Nashville. And adding these partners in child care is making it easier for families to access the services and connecting other families who may be able to support each other. So really we have two main sites that are providing kind of this extra layer of care. We even have support groups going on at those sites where families can get to know each other. If you look over to the right, we've been able to add employment navigation through Staff 360. And this is really a partner who can focus more specifically on not only helping families get connected to income. We know families can connect to some of the minimum wage jobs out there really quickly, but we want someone who can really help build bridges with employers and build career tracks where, families can begin making longer term plans, for that upward mobility. We've added a financial counselor, and so and I'll talk about this a little bit later when we talk about our funding history, but the Financial Empowerment Center here in Nashville is funded by United Way and our mayor's office. And they've helped reduce millions of dollars in debt for Nashvillians, and we're able to have a financial counselor that's part of that team that really works specifically with our family empowerment families to go more in depth with a family, to provide, some expert knowledge around what does the credit score mean? How do we interpret some of this debt? How do we prepare our tax returns and negotiate some debt? So there's some expertise around these certain areas that we're able to build around the family. And really a family oftentimes meets with a case manager first, but soon after they're introduced to these other components, and each of these partners that are working around a family, we're sharing data in our database and being able to kind of update each other on where are we in the process of setting goals in these certain areas. So that kind of gives you a picture of how those services work around the family. So I just want to kind of take a second to kind of look at this path of funding that we've been able to see from 2014 until now. And this is a slide that we shared at the CMER conference in October, and even preparing this slide really helped us kind of see where we've come from and kind of how things have built on each other. So in 2014, the CMER Institute, started funding Nashville with $100,000 as seed money, and really, and this is kind of based on some things that we've heard about kind of why CMER was interested in Nashville, and y'all can correct me if I'm wrong, but I think they were drawn to Nashville, and we were the 10th city to be funded because of our Financial Empowerment Center that I mentioned before and our Family Resource Center network. We kind of were set up to be able to maybe mobilize some resources around families. And so that year, United Way added about $255,000 from our outcome-based investments into the community. So when we say outcome-based investments, we mean corporate dollars that are coming from folks that were raising money out in the community that is coming to United Way that's given back out to community partners. And so when we added that $255,000, we had about $355,000 that went out to start this family empowerment program, and it started at Catholic Charities in Safe Haven. So they were the first main partners that received this money. Those first 2 years, and this is why it's kind of relevant to bring up the fact that I was at Catholic Charities when we started. There was a lot of traction that was built around this work, and the Catholic Charities in Safe Haven and United Way were able to work together on kind of building some leverage dollars. So we ended up being able to raise about $500,000 annually at those agencies, and that consisted of maybe HUD funding, the Diocese of Nashville, local foundations. We were able to kind of bring that amount to a different place where we could really start seeing this work as an initiative. So United Way really started looking at this to be a place an area of work to put a stake in the ground. So when the next RFP came out in 2017, what was really interesting is some of the work had gotten attention from our Tennessee Department of Human Services. So in Tennessee, DHS is the office that really makes sure that SNAP benefits are given out, that TANF benefits are given out, child care vouchers. They're providing that across the state. And they were really interested and started talking to United Way about how can we partner together to make sure that we are providing really quality services to families and really taking more of a two-generational approach. And so they started, having this discussion with United Way and, created kind of some grant ideas and contract ideas around how this would look. And so the year that we gave out the next RFP in 2017, DHS was able to add about $830,000 into this FEP work. And if you think about that handout I showed you, the thriving section of that is really this first contract with DHS. So that's when we really started ramping up, more partnerships with other partners that had that could really help with different layers of services like child care and not just case management. So this gave, and I guess I need to kind of explain, this was kind of the magic part of it, but at the same time that United Way was having conversations with DHS, Catholic Charities and Safe Haven were also contacting DHS because we had heard from other states that TANF dollars were being used for housing assistance. And so as soon as this first contract started with DHS, it allowed for some more staff. So I came over to United Way and we started kind of talking about what could it look like for DHS to really support the entire continuum of services that FEP provides. So not just this thriving section, but how can they also make sure that we're supporting families at their most vulnerable point, so when they're experiencing homelessness. And so we worked out a second contract where we were able to get funded for $1.4 million per year to also pilot how do we really address homelessness as well. And so with that funding, that's what kind of has built our structure around how we're addressing family homelessness and poverty. So if you look at this next slide, this is really our current funding structure. Just wanted you to kind of see, so we have $100,000 from CMER coming to United Way. Now we have the Tennessee Department of Human Services. It's about $2.4 million annually, and it comes in a couple different contracts. And then the corporate partners and donors are adding about $350,000 annually to that amount, and that amount is being distributed to our partners. So one of the questions that came up, we can go to the next slide, when we talked about this at the conference, I think a lot of people were just kind of like, how did this happen? Like, what does collaboration look like for you all? How do you have all these folks that are working on this and gaining this momentum that you have? And I really think it comes down to just some of the trust that we have been able to build among these partners. So on the screen, you'll see kind of the 5 different elements of collective impact work. So I think it would be helpful to kind of share, how we're addressing each of these elements from the United Way perspective that's kind of built this collaboration. So we act as the backbone support of the Family Empowerment Program. So we're spending a lot of time and effort supporting the work of the partners, creating spaces to have needed conversations, creating action steps and timelines around different parts of the work, giving data support, ensuring, someone's representing this partnership at meetings so direct staff, don't have to do that. We're also, pulling together reports for these major funding streams. So United Way is taking that on based on the data that's collected from the partners. Those reports are turned in. And so thinking about shared measurement, and Hannah is going to talk a little bit more about the data portion, but, we went through fall a big transition for our database. Early on, our partners, Catholic Charities and Safe Haven, were using our service point system, so our HMIS system in our community that all of our homeless providers use. We're still using that system, but we realized when DHS kind of came into the picture that, gosh, we're needing to track a lot more kind of unique things and unique layers to this work, and we wanted something a little bit more user-friendly, something that could kind of combine and look at the totality of the program. And so we switched to Salesforce. And what we were able to do is kind of with this radical customization that our consultant was able to help us with and is still helping us with, we've been able to make sure that everything is still being put in HMIS that makes sure our partners are compliant, but we're also able to keep everyone in one system so that we can share the appropriate information that we need to share to make sure the work happens and that families are served really well. If you think about continuous communication, we're talking all the time. I mean, we're emailing, we're meeting, we have a monthly supervisor meeting, a quarterly FEP all-staff meeting. Sometimes I worry that we're too involved, and we want to get feedback around that portion because we want to make sure we're creating autonomy for our partners, but we're also making this, one initiative. And so, constantly wanting to get feedback from partners about, our involvement and how we can improve that is something that we're really committed to. I think the way we were able to keep a common agenda, I think about a lot of the grants that we put in, no matter if it was one partner, applying for one funding stream, any time that any of us wrote grants over the last few years, we're sharing the work as a collective. So Catholic Charities isn't necessarily applying and saying, this is what Catholic Charities does. They're applying and saying, we work with Safe Haven Family Shelter, we work with United Way, and we work on this big initiative. So as we were applying for grants, we're constantly kind of sharing, what it looks like as a collective. I think that helps build that trust because we're putting, everybody on one application. Even in the design of, one thing I can talk about is just kind of the way we've designed some of these partners that have come on board. What comes to mind is at Fanny Battle Daycare or Day Home, we have a Catholic Charities case manager that works on site there. And what we thought about that happen is what's going to be the best thing for families to see. They already trust Fanny Battle, and so we're going to make sure this case manager is seen as a Fanny Battle team member, a Fanny Battle staff person, even if they're employed by Catholic Charities. And even though, Fanny Battle has never really done case management, we didn't want Fanny Battle to have to learn how to be case managers for their families, but we can connect and partner in a way where it's all seen as kind of the same. We're all seen as being on the same team rather than separate. I think those are some of the things that have helped build that trust. And then lastly, just some of the reinforcing activities we do. United Way is really trying to bring partners together around professional development. We've brought in national trainers on trauma-informed care, on diversion, and we're constantly trying to provide activities where we're all kind of learning how to do this work better together and in the same way. So without further ado, I'm going to hand it over to Hannah. I've talked so much. Like I don't have anything left. So Hannah's going to talk about our evaluation approach now.
Hi, everyone. My name is Hannah Wolshin, and I am a principal consultant with Elevate Evaluation. And really, our job as evaluators is to help service organizations really understand, if what they're doing is working. And not only is it working, but how is it working, and then how to make it better. And one way that we typically do that is through evaluation. So for those of you who have maybe more or less experience with evaluation, evaluation really is fundamentally about learning and improvement. For those of you who have had the opportunity to do an evaluation or be part of an evaluation, sometimes maybe your perception was that it's more like auditing, but I promise that while evaluation is supposed to and can identify areas for improvement, it also can really play a big role in uncovering the things that are working really well so that you can augment that. And then for us, in our approach, evaluation is really about use. So we really don't need to collect all the data. We should be collecting the data that is most meaningful for decision making and driving program planning so that you can augment the services and the important work that you all are doing every day. And just by way of background too, evaluation can happen anytime in a program's life cycle. It is generally more helpful when it's engaged earlier in the process, but collecting information, even to whatever degree you're able to, is really informative and helpful regardless of kind of where you are in the evolution of the programming and services that you provide. So I wanted to provide a quick overview of kind of our large goals for the evaluation of the entire spectrum of FEB programming. So as Matt mentioned, there are 3 buckets, but these are really kind of our big overarching goals for the entire body of evaluation work. So first, we really, really wanted to identify the key metrics, again, that support decision-making and action. So as you saw on the slide that Matt showed, this is a really complex program. There's lots of information that we could potentially collect, but really what we want to know and where we want to put our time and our energy is into collecting the information that we really need to know, again, to drive improvement. Secondly, we really wanted to create a system that generated quality data, so we want to be able to have confidence in the data that we're collecting and the results that we're finding without adding unnecessary burden to staff. So we have a lot of partners, as Matt described. A lot of our care team members and direct service staff have to be in several different systems where they're capturing different information for different funding streams. and we really wanted to, where we could, not duplicate efforts, make sure that the data collection, because they are doing the bulk of the data collection for us, which is really critical to this project, we wanted to make sure that that was as easy as possible. And then finally, at the end of the day, the big goal is we want to know how FEP is affecting families in Nashville. What do they look like when they come out of the program? And I want to frame the next couple of slides up for you all. So as Matt mentioned, there are a couple of different service lines, and this slide and the remaining evaluation efforts of our expanded coaching service line, that part of the project in particular has much more stringent kind of evaluation data collection requirements based on the funding that we received. So some of the enhanced components of the evaluation that we've put in place are really just for that service line. So I'm going to focus on that here, just so you all know that this is really based on kind of a subset of that larger FEP program. But first, we started our entire process off with a logic model. So some of you may be familiar with logic models. But at the end of the day, logic models are there to clarify key outcomes, again, trying to kind of cut through the noise and identify the things that we really, really want to know, kind of asking our magic wand question, what do we want families to look like when they come out of the program? What should have changed? And then really making sure that the activities that we engage in actually link to those outcomes and the impact that we want to see. So ensuring that there are clear logical paths between the specific activities that we do and then the outcomes that we hope to see. And a lot of this, too, is you don't want to hold yourself accountable to, measuring outcomes that your program activities can't feasibly achieve. You really want to make sure that there are clear linkages between what you do and what you hope to achieve. The second piece of it was, creating our data collection plan. So once we had those variables identified in our logic model, we needed to figure out a way that we wanted to measure them. So we created methods around each of those variables. And really the data collection plan is kind of our process workflow for the evaluation. So it identifies what data we're collecting, when it's collected, so what time frame, are we doing it every session, are we doing it every 6 months, where it's supposed to be collected or how, so is it on a form or a particular tool, and then of course who is supposed to collect it, who's responsible for providing that information. And I should mention too, in our data collection plan, I'm going to talk about this in a moment, we divided our variables up into process and outcome variables, and I'll get into that in just a moment. Once again, we had the methods developed, we had to create tools to collect that data. So we actually created a battery of a couple of different forms and assessments. So we created a household contact log to kind of collect information about the families. We have session logs, a goal tracker, an event attendance tracker, an activity and referral checklist, and an evaluation assessment. So we did have to create some tools that the case managers and other members of the care team use to collect information about families. But all of these are in service to, again, trying to identify and measure those outcomes that we identified in the logic model. And then finally, we had to build a system to both enter all of this information and then create a system where it could be housed as well as easily accessible for people like United Way and myself as we look at that data, report on that data, and try to understand how the program is performing. And as Matt mentioned, we did do that in Salesforce, which is probably, I think, an atypical use of Salesforce, but it has worked. It has been really helpful in that it is very flexible and eminently customizable, which has really benefited us in this project.
Hey, Hannah, this is Ryan from the Seymour Institute really quickly. My experience with evaluations has been work with an external evaluator for a couple of months, get a report at the end, and try to implement the key findings. It sounds like, and I could be wrong, but it sounds like this is an ongoing engagement with this project, between you and this project or your company and this project for a while, maybe years to come. Could you tell us a little bit about that?
Sure. So yeah, I think evaluation is really flexible in that, depending on the needs of the project, it really can be as involved or not as involved as, clients or program folks want. But for this particular project, yes, we benefited from being able to be part of kind of more of the design process for the program. So as different roles and responsibilities and the program was kind of really being fleshed out after the DHS funding was provided, we got to be there really at the beginning to start talking about and asking those critical questions around, okay, well, what do we really want to see? We can do a lot of different things, but where is going to be, the best focus for the kinds of activities that we engage in, and then really being able to design an evaluation and data collection system that complements that and really is in service to that. And as far as follow-up, yes, I think, especially from my personal perspective as an evaluator, if I leave you with a report and then do not follow up with you afterward to make sure that, the things that we identified are actionable, that the things that we identified are relevant and feasible, I don't know that I'm doing my job particularly well. So yes, I think that we do intend to ensure that there's follow-up to this, that we are really trying to track and build and make this an iterative process as opposed to a kind of one-and-done sort of project. Recognizing that that's not always feasible, but that is definitely ideal.
Great, thanks a lot.
So I'm going to talk a little bit about some of the data that we collect. And I'm going to start with process data, and I mentioned that just a moment ago. And by process data, what we're talking about is really not just what happens to people after they come out of our program, but what actually happened to them while they were in the program. And this is really critical for us because it's great to know that families improved at the end of the day, but if we don't know how we help them improve, we can't do anything to the systems that we have control over to make sure that those improvements continue or are maintained or maybe even made better. So we need to know kind of what's happening on the ground. And some of the data that we collect to support that are things like enrollment, which I think is a pretty typical metric for programs to collect. That should be pretty common. Demographic information, so what do our families look like? This program was designed for a particular kind of client. Are we actually serving those clients? Do we need to maybe adjust that? Dosage, I come from a health background, so this is just my language for how much and what kind of services are people getting. So with FEP, and particularly the expanded coaching service line, folks can access an array of different services. Well, what are they accessing and how much, how intense are those services for those people? Grant spending, this has been a recent addition actually to our Salesforce database around, how much direct assistance are we giving to families and monitoring some of those budget line items. Events, what kinds of events are we holding for families? How is attendance at these things? Again, helping to kind of identify places where we might want to pull back or enhance what we're offering. And then finally, participant satisfaction. Obviously, this one's kind of self-explanatory, but we would want to know, while people are in our program, if there are things that are really egregiously wrong, we want to know that so we can change that while people are still with us. Or if things are going really well, we want to make sure that we can enhance that. So I'm going to show just a couple of kind of examples, again, of the information that we have at our disposal because we're collecting some of these metrics. So here's our monthly enrollment. Again, this is just for our expanded coaching service line, so it's not representative of the FEP program as a whole. But we are tracking this monthly, again, trying to get a sense of what's our capacity for getting people in the program. What does it look like? I mean, is it cyclical? Are there times of the year when we maybe need to enhance that a little bit more? Again, this I think is something that folks are pretty familiar with. Here's our dosage example. So again, I'm just trying to show some of the information again that we have access to because we have our session logs. So case managers and other members of the care team are actually completing session logs every time they meet with a family. So we do have information like the average number of sessions per family. We know how long they're in session on average. We've got our kept appointment rate. So what percentage of families are, not canceling or no-showing? I think this is something that's important to track because if we're seeing this dip a lot and we're, having a really low kept appointment rate, there might be something that we need to do on the programmatic side to keep people engaged. And then, of course, sort of the service breakdown. So who are families meeting with most often? And unsurprisingly, I think for us, it's really the case manager. As the case manager for this particular service line is the primary kind of point of contact for families. Here's an example of one of our kind of event attendance tracker pieces. We're really just kind of interested in the kinds of events that are being held and where people are kind of putting their time and effort. As you can see here, some of our families, or most of our families are, kind of more attending the community dinners and parent support groups. So that's something that probably we want to, continue doing because families find that useful. Okay, and then so outcome data, this is kind of the metrics that are really showing what happens to people and families who come through our program. So our outcomes are things like changes in behavior, changes in knowledge, in status, perceptions, confidence, all of these things that actually happen to the individuals who participate. This is kind of a subset of our outcomes. We have a couple more, but these are kind of the key things that we think are really important. So we collect data on goal progress, so when are goals achieved and whether or not they're achieved. Housing and employment status are obviously critical because those are big goals for the program. Parent and child education, so are parents enrolling or completing higher education, and then how are children progressing through their educational programming. And then community involvement and social connectedness is kind of a unique one too for FEP and something that we think is really important. And this information primarily we collect through our goal tracker document. So again, this document where case managers and members of the care team are identifying what goals families have decided to set and tracking progress toward those goals. And then our evaluation assessment, which is a much more comprehensive assessment tracking more self-report items for families that's completed every 6 months to kind of track how families are, again, improving or not improving as they move through the program. This is a pullout from our evaluation assessment data. So we have divided our metrics too, I should mention, into 4 pillars based on the services that families have access to. So one pillar is parent and child educational metrics. And so this is a subset of information that we collect about parents. And a key goal for us is making sure that parents are involved in their children's education and that we're improving or working toward improving family literacy. So we have a couple of items around these things on our evaluation assessment. And this graph is just showing that we're seeing some moderate growth in some of the key areas we've identified. I should also note that this is only on 3 families because we've only had 3 families who have completed an initial and an exit evaluation assessment. And largely that's because a lot of the families who we're serving are still enrolled in the program, so a lot of folks haven't exited yet. But the more that occurs, the more data we'll have about what people look like, when they came in, and then also what they look like when they came out. Here's an example of some goal progress data that we're collecting. So this one's a bit of a combination of process and outcome because it's showing both where families are setting a lot of their goals and where they're also achieving them. And you can see here that families in the expanded coaching service line are really interested in focusing on economic status and supports and increasing those. That's where they have the most goals set with their care team and also the place where they're achieving the most goals. And this is really just a snapshot of some other key outcomes of kind of where we are today in the moment with our expanded coaching folks. So right now, in terms of adult education, which we're really proud of this, we've got 5 adults who have successfully enrolled in higher education programming, so they set that as a goal and have completed that, and 3 adults who have actually completed post-secondary education or obtained a vocational certificate. 26 of our families have had at least 1 session with a financial coach, meaning so close to a third are really actively engaging with a financial coach and voluntarily engaging with that financial coach. And we've got 52 heads of household who, at this moment, have obtained or maintained employment, which is also really critical in terms of building that foundation for stability.
And then I guess just kind of looking at time too, we'll just kind of end with this slide. So we just wanted to also give you kind of a big picture of just what the FEP kind of how many families we've served since 2014 and kind of some of the main, some of the SEMR outcomes that we've seen. So we've served over 600 families now, which is really exciting. We're projecting to serve about 300 new families in 2019, and that's all because we have kind of this expanded funding. We know that 319 families have been housed, 188 have been prevented from homelessness. And then on our last SEMR report, we were able to share that 53 families in 2018 had significant increases in income. And so to us, that means they went from 0 to something, or they increased by $500 in their monthly income for this year. So just wanted to give you kind of a snapshot of the program in full and those outcomes that we're tracking. And we can be done, so we can have some questions at this point.
Thanks a lot. So if anyone has questions for Matt and Hannah, please go ahead and just chat to everyone. That may be a little more controlled than opening up the lines. But if you have questions, please type some in. I have a question that I'm curious about. You all built a pretty sophisticated data collection platform in Salesforce, and you've implemented that recently, and I'm sure that was an interesting process. But my question is, that's true. That's a good point. It's an ongoing thing. How important is that data platform for the success of your collaboration among the partners, if it is at all?
I think and Hannah, you can help me out too, but just from kind of on the ground experience, as soon as folks can kind of understand, where their families are with other partners. So if they're working with the financial coach, the case manager and financial coach may not see each other for weeks, but if they can really have that communication in one system where they're being able to comment on different goals and what they're achieving when they do meet and if they've met, that changes everything because it kind of cuts back on, emails. We have on Salesforce, there's actually some different functionality where you can log a call or log a text with a family, and everybody sees that. So if a case manager is trying to reach out and hasn't been able to hear back, everybody sees that that's happened, and so it kind of keeps people informed and prepared when they are having a session with a family. And we've heard over and over from partners that that's really kind of revolutionizing what they can do with a family and what to expect. And that couldn't happen in our HMIS system. So I think that's why it does, to answer your question, it definitely does contribute to some of the success.
I would add too, there are still ongoing challenges. Anytime you bring, a group of people together around collective work, it's difficult to make sure that all the needs are met and that everything is happening. But I do think that the system in Salesforce allows people it makes data too a lot more accessible because people are getting into it every day because there are meaningful things that they need to get out of it that actually help with some of their workflow. I think that has been critical to, again, making sure that everybody's kind of on board with the process and giving them access to that information.
We have a few great questions that are coming in from the field that I want to have you respond to. The first one is, do families have access to the goal tracker?
So that's a good question. We know that we're trying to decide, and I'm not sure when it's going to happen, but we want to have a print functionality so we can print that goal tracker whenever they set anything, and that's something we just haven't done yet. But I know that case managers and the employment navigator and financial counselor are sharing those goals. I don't think they have access as far as like logging into the system and being able to look at it themselves, if that's what you're asking. But they're being shared, anything that's going into that system if they want to know that information.
Great, thank you. A couple more system kind of questions. First one is, do you have a memorandum of understanding with the city or with your program partners? And if you do, is that something that you'd be willing to share, the structure of that you'd be willing to share with the CEMR network?
Yeah, we definitely have, releases of information that case managers are using when families enroll in the program, to make sure that we can share the information across partnerships. So it lists all of the partnerships and all of the partners within the FEP program. And we talk about how this information is going to be used as an evaluative tool. So all of that is shared. We can definitely share our releases of information. As far as between the partners, I don't know if we've established that as much.
Maybe the partner agreement.
Yeah, there's a partner agreement. We can look at what we have and make sure, if there's anything we can share where people can, use that as a structure, we definitely are happy to do that.
Great. That would be perfect. If you can share it with Ryan, then Ryan will make sure that it's shared out more broadly. I think both of those pieces might be interesting for different community partners depending on where they are in their development process. So if you could share both of them, that would be great. And when you're working with your community partners and this tight team that I know is working together quite a bit, do you have any type of priority referral system with the daycare providers or the homeless shelters or any of the other partners?
Yeah, so the majority of families that are coming in to the FEP, we're using our coordinated entry system with the city. So our city government, Metro Social Services, is the lead agency that works on the family coordinated entry system. And so daily referrals are being made from that system. And so all of our partners that are working with families that are literally homeless or are coming in, experiencing homelessness, that's where the majority of those referrals are coming from, just to make sure that we're, serving those who are prioritized that are most vulnerable. But with our site-based work, so at our child care centers, a lot of that is more, we did several months of kind of recruitment almost and trying to learn what we needed to message, because the thriving kind of section on that handout, we're really looking for families who want to set goals around higher education and increasing their income. So there's a little bit of a different kind of expectation with those families that are coming through at those centers. They're more stably housed than our families who are coming in experiencing homelessness or getting an eviction prevented. So there are a couple ways people can come in, and a few different eligibility requirements due to our DHS funding.
Got it. Thank you for that. What's the average length of enrollment for the folks in your program? Is it vary greatly, or is there an average length that you see for most families?
Yeah, so we do have, standard to most programs. We have, folks who maybe drop out earlier, and typically what we're seeing so far is a lot of the folks who drop out, they're dropping out probably within about 3 months, although that's not super high. Most of the families are still engaged, and a good many of them are going on over like 6 months to a year. I don't have that number in front of me, but they stay engaged for a while. And I believe that our kind of threshold for families to be engaged is up to 2 years. So really, as long as they're willing to stay engaged and continue to work on goals and engage with the financial coach and the employment navigator, those services are available to them for a while.
And it really depends on what kind of goals they're setting. So we have several families who are looking at going, we had 2 that graduated with their associate's degree in December and 1 that got a master's degree in December. But they had already kind of done some work with for those programs. So if we have a family that comes in and wants to go back to school, that may prolong their time in the program, especially if we're helping with some of those costs. So it kind of depends on their goals as well.
Got it. When you are looking at outcomes, and maybe this one's more for Hannah, when you're looking at some of the outcome measurement, are you utilizing the Arizona Self-Sufficiency Matrix and progression along that matrix as part of your outcome measurement, or do you have other outcome measures that you're looking at separately?
Yeah, actually, thanks for bringing that up. I meant to mention that with the evaluation assessment. So we have looked at some of those tools and other standardized metrics. But ultimately, we ended up creating our own kind of survey assessment tool that makes up the body of the evaluation assessment. So we are not using that. And largely that was because some of the metrics, again, that we had to collect for the DHS expanded coaching portion in particular didn't completely align with that. And we felt like it might be, again, burden on staff to collect that in addition to the ones that we felt like we really needed to know in order to track, progress through the program.
Super. And the last question, because I see we're almost at the top of the hour here, and I'm going to read this one because this one's a little bit longer. Do you require all FEP partners to use the Salesforce system as the central case management, data collection, and reporting system, or are some partners using other systems in parallel and maybe duplicative with the Salesforce system?
Yeah, so what's funny is we really haven't had to require everybody to use it. I think everybody wanted to. That was a decision process that we went through together. So all of our FEP partners right now are using the Salesforce system, but we have other, like I mentioned, our agencies, partners who are, receiving HUD funding, they're required to use our service point system in the city, our HMIS system. We're helping make sure that the data they need gets into that system to stay compliant. Fannie Battle Day Home, for example, they use some different tools that they have to use for assessment and for attendance at their location, and we're able to pull some of that data and put it into Salesforce. But yeah, there's definitely kind of this cohesive perspective on everybody that's working directly with a family. So if it's a case manager, family, or a financial counselor or employment navigator, all of their information is going into the system, but we're kind of using, other systems to try to make sure we're pulling, a full list of data points that we're trying to have. We also, just to mention too at the end, we're excited because our Metro Public School System here in Nashville we finally have an MOU with them, and we're starting to get attendance data for the public school system, and we're hoping to get grades for the last couple of years that we can kind of analyze and put into our first big report of this final year in the pilot. And that's somewhere we've never been able to really talk about those data numbers. So that's really exciting for us too.
Great. Well, Matt and Hannah, thank you very much. This is Rob. Greatly appreciate the time and energy put into preparing for this presentation. You can tell, obviously, with the questions that were asked, we have a lot of individuals that are out there excited about this. So I wanted to thank you and thank everybody who joined on the call today.